Hi everybody, my name is Dr. Tina Bhutani. I'm a dermatologist practicing in San Francisco, California. I'm the CEO of Synergy Dermatology, and I'm also an associate clinical professor at the UCSF Department of Dermatology. Today I'm really excited to be here at the AAD Innovation Academy, and I was honored to speak in the Skin of Color primer session where I spoke about the presentation of inflammatory skin disorders in Skin of Color. My particular talk focused on psoriasis, atopic dermatitis, and hidradenitis suppurativa. And really what we focused on was, first of all, the presentation in Skin of Color and how it can oftentimes look different. So for example, in psoriasis, we see different colors, we see more scale, we see more prevalence of high impact site involvement like the scalp. Similarly, in atopic dermatitis and HS, we can see a lot of hyperpigmentation and also hypopigmentation in some cases, which can have a huge impact on quality of life. We also discussed the misrepresentation of race and ethnicity in clinical trials and how we haven't done a really good job of including diversity in those trials in the past, but we now have two trials, the Visible trial for psoriasis and the Admirable trial for atopic dermatitis, which have focused particularly on patients with skin of color. And so we're able to study outcomes in these patients. Luckily, they do really well. So we saw great efficacy, we saw great safety in these studies, and there was no new signals that came out of them. But what really we're able to do is study the patient journey. So we can look at things like post-inflammatory pigmentation, post-inflammatory hypopigmentation. And in the Visible study, they saw that there was actually a stronger correlation with quality of life with the pigmentary scores than there was with the PASI scores. So again, the pigmentation is actually probably more impactful for patients than the disease itself. So these are new outcomes that are coming out for Skin of Color of inflammatory diseases. And really the focus is on doing better with our future research and hopefully creating new outcomes for our patients.